Well, we are live. Welcome. Well, we are live. Welcome again. I'm Suzanne Lynn with Dr. Chuck Reinertson of Lifetime Dental here in Tavares, and yourfilthymouth.com. If you haven't had a chance to visit yourfilthymouth.com, it's not a porn site. It's very appropriate. It's
Yes.
G-rated, and it's about the health of your mouth, and it's got some amazing videos and information on there. But welcome, Dr. Chuck. I love our Thursday night Facebook Lives.
That's great.
Yeah, because tonight we're going to revisit what the mission is, why we're doing these. Instead of focusing on one specific topic, it's really about what happens in your mouth is affecting the rest of your body, and that's the message.
Two examples just within the last week. One of them, we had one of our patients was talking about a coworker they had that had been sick again and again. Goes to the doctor, gets on an antibiotic, feels better. His work for a while, ends up getting sick again, go back to the doctor, give more antibiotics. So this was going on for actually a couple of years.
Wow.
Finally, this person went to see a dentist. They took care of the person's dental needs. He had some infections going on. This has been months now, and this person has not been sick again. So, can you take care of the dental needs and possibly help some of the medical needs?
Mm-hmm.
Absolutely on that.
Mm-hmm.
What was so interesting is the very next patient I had, we were going to be removing an abscess tooth. She came in earlier. We saw a big abscess tooth that was not savable. We put her on antibiotics. And by chance, she had an appointment with her physician the day before she came in with us.
Okay.
And when she was talking with her physician, she said, "My dentist says that my infected tooth can be affecting my overall health. What do you think?" And the doctor went, "Yeah, right."
I don't even know what to say to that.
We need to begin connecting the dots between the mouth and the rest of the body. Yet now with this presidential election coming up, I hate to even say this phrase, but I go by the phrase, truth trumps belief.
Mm-hmm. Mm-hmm.
And there's so many times we want to believe something, but we have to look at what's the truth.
Right.
What's the truth? Truth trumps belief. You can believe the earth is flat.
Right.
It's not going to make it flat.
Exactly.
Okay, so we have to be looking. So whether it be a physician, another dentist, a coworker, whoever it is, we have to be looking for what the truth is, and not necessarily what we just happen to believe at the moment.
Mm-hmm. All right, there's two things that are coming to mind. I'm going to try to remember both of them. The first one, going back to the doctor that said, will you talk about why is a life-death decision to make with that?
Well, physicians were never trained, at least the ones that I've talked to really include the mouth as they're going through their analysis of what's going on with the patient.
Mm-hmm.
Dentists in fact, I've heard this from medical students. If you're a dentist, it's like you couldn't make it in medical school. It had nothing to do with it. I never wanted to be a physician. My brother's a pediatrician.
Right.
Not all kids get well. I
Right.
didn't want to deal with it.
Right.
So
Right.
dentist was my number one choice. So it's not a matter of you couldn't make it in medical school, so you're a dentist. No, it's our choice.
Right.
But
You focus on the mouth, like some people focus on the heart, like some people focus on the brain. Like
basically specialists of the mouth.
Right.
And they've broken the body up into so many different parts. You've got the heart, you've got the lungs, you've got the kidneys,
Right.
you've got the GI system, you've got the bones, you've got the brain, you've got the eyes, there's a bloodstream that connects everything. So if you have trouble in any one of these areas, it's going to transfer whatever bacteria or toxins through the whole body,
Mm-hmm.
and it's going to affect other things other than just your little niche, or whatever that
Of
is.
what you specialize in.
Yeah.
So that abscess mouth that was producing pus inside, it was going through her bloodstream.
Yep.
And he was just being very short-sighted about that.
Well, it wasn't taught in medical school. He didn't see it in medical journal. In fact, it was a female physician, so she didn't see it in a medical journal. If you just get on the websites of the American Heart Association, the American Diabetic Association, the American College of Obstetricians and Gynecologists, just go on some of their websites. That's there. The reason we have yourfilthymouth.com is so that we have links that go to the research. So it's really easy to get on there and say, well, gee, how does it affect the heart? Here's the research. How does it affect diabetes? Here's the research. So we're trying to make it easy. So, here's the easy button you can push and learn a whole lot more without having to search yourself.
So we've heard story after story about people who have had high blood pressure and diabetes, and the problem came from what was happening in the mouth. So the way this affects you is if you're having some medical problems, maybe it's even been years, maybe this has just become a lifestyle for you, but you haven't gone to the dentist and considered what's happening in your mouth, maybe?
Well, rule out the mouth as the source. We're not saying the mouth is everything.
Right.
And this is my opinion. We have 5 things to help make us healthy. Number one is what we eat. That does play a big role. Number two is some exercise. Doesn't mean you have to join the gym, but you got to get that body moving every day. Number three is a healthy mouth. Doesn't mean a Hollywood smile, but you've got to have a healthy mouth. You can't have infections in there. Number four, a good night's sleep. That really affects our health. Number five is our attitude. That affects our health too. So we're focusing on number three, which is a healthy mouth, but it takes all of those things. And by the way, all of those are affordable. We're looking at, last night was the Democratic presidential debate, and they're all talking about health care, but they're talking about providing more health care for people, but we're not getting into why do you need the health care? How can we prevent the diabetic crisis? How can we prevent the cardiac crisis that we have? How can we prevent? And so much of this is our lifestyle. In Europe, they don't have the same issues because their lifestyle is different. So they may have socialized medicine, but they don't have the same medical issues because they walk a lot more. They eat fresher vegetables and things. Their lifestyle is different.
So it's comparing apples to donuts.
Yeah,
I just made up that. Yeah. So what we were talking about before we started doing Facebook Live was that you can't just keep throwing money at stuff that it's not like a $1 million bill is not going to get you closer to good health.
No, money can't solve these issues. Prevention is not sexy, but it really does save a lot of different issues. And so if we can, rather than focus on how much money can we spend on healthcare, let's focus on how can we stay healthier to where we don't need that type of healthcare. This doesn't, there are situations we need medications, we need physicians. So I'm not saying we don't need any of these things. We certainly do. But we have to look at the percentages, and there's an awful lot of preventable disease that's going on right now that is costing us not just millions, but billions of dollars.
And we're trying to get the word out about that. This is what we're doing. That's why Dr. Chuck is on WQBQ here in Lake County every Monday from 12 to 1. He's going to be talking more in depth about reclaiming your health and what the mission is and why this is important. Also having done a TED Talk, and that new version is going to be out pretty soon, right? We
had the screening of it last night, so within another about 2 weeks, it should be available on YouTube online. So that'll be fun. We'll see what happens with that.
Yeah. We've got a question.
Sure.
Our question comes from Gloria, and she's asking about, which is now making me paranoid because I'm sitting so close to you, about bad breath. And she wants to know what can she do about it? And why does it happen, basically, and what can she do about it?
Well, there are several things that can cause bad breath, okay? If you're diabetic and ketosis, that can give you bad breath, acetone breath. But the number one cause of bad breath is gum disease, periodontal disease, which does not hurt. And that's the one thing people think when you have some type of disease, isn't it going to hurt? No, gum disease doesn't have any pain. But yet you've got all this toxins and stuff going on. But that's the bacteria causing it can give you bad breath. One of the nice things, there are now saliva tests where you can check and find out what bacteria you have in your mouth. Then they can come up with specific antibiotic rinses that you can use that kill the bacteria, the bad bacteria, and you're not swallowing.
That is so cool.
Because you're not killing the good bacteria in your gut,
right?
Just the ones in the mouth. And a lot of these tests were originally designed for bad breath, and they work. So once you get the gum disease under control, bad breath generally goes away. If you just had some garlic, that's something else.
Right, or onions or something. But so you're saying that I just want to repeat this, that there is a test that you can take that specifically targets what bacteria is in your specific mouth causing the bad breath.
That's correct.
That is so cool.
You do swabs in different areas of that. You send it into the company. They analyze. They can tell you if you're below the threshold, above the threshold, what bacteria you have. Are these really bad ones? Or are they not so bad ones? But it gives you a really good idea what's going on inside the mouth. Now you have that specific antibiotic rinse that is for that individual. And then there's some other things you can do to make sure your mouth stays really clean, because you got to clean it.
Yeah,
I mean,
of course.
You can't just live in a garbage pail here. You've got to clean it up.
Right. So one of the things I was mentioning is that we had a pretty long discussion last week about how long I'm actually taking to brush my teeth, and I kind of got busted on that. So I've got an electric toothbrush, and you know what? I've felt in the past, I don't have time. I've got to do this, that. Well, I've started using the electric toothbrush and doing chores. So now I'm putting clothes away with one hand and brushing with the other. It's an electric toothbrush. It does all the work.
I am not hung up on technique. I'm not hung up on when you do it. The whole idea is to thoroughly clean your teeth one time a day. And I've changed my tune from what was years ago. I'm saying one time a day, spend 5 to 10 minutes, one time a day, thoroughly cleaning your teeth. And you decide if you want morning, noon, or night, whenever you want. But I would rather see you do a really good job one time a day than an incomplete job 2 or 3 times a day, because you're still leaving the bacteria in the bad places, and it's growing, you're making calculus, your gum disease, all these other problems. So one time a day. And there's not many dentists you're going to hear, I think, telling you
That's true.
thoroughly clean your teeth one time a day is fine. And if you want to do a halfway job, or use some mouth rinse or something other than do whatever you want other times of the day. But one time has to be good.
You practice what you preach. And I'm really impressed because recently you said that you actually use the disclosing tablets.
Yeah.
And that sometimes you're proud of yourself and sometimes you're less than proud
Other than
of yourself.
yes. Yeah. About once a month I'll do it. Now,
That's
my
great.
personal routine is I do mine all in the shower in the morning when I'm getting ready. So I use an electric, so I take my shower and wash my hair, wash my body, I shave in the shower. Then when I'm finished with that, I use an electric toothbrush. My routine is I do 2 minutes on the top teeth, 2 minutes on the bottom teeth. So it's 4 minutes on that. Then I use something called a shower breeze. It's like a water pick, but it hooks up in your shower. You can get it on Amazon. We've got them on.
Kind of like a water pick.
Yeah, just like water pick. And you can use a water pick by the sink too. But then I shoot that directly in between the teeth and let it run through the gap for 5 full seconds, all the way around, top and bottom. And then when I come out, I'm pretty much done. Then about once a month, I'll chew up one of those tablets and I'll check myself. And like I said, some months I'm like, yeah, Chuck, you did a good job. Other months like, oh, come on, you can do better than that.
Wow.
And I've got teeth, I've got gums, I've got the same issue as anybody else. I'm not immune.
So as a final thought here, as far as how we're coming 360, going back to the original story of the physicians, what would you tell someone who's maybe having some health problems and not sure if maybe it's connected to their mouth? Can they talk to their physician?
You can talk to your physician, whether they have an open mind or not. I don't know. There are good physicians out there. There are other than good physicians. There are good dentists out there. There are other than good dentists. There are good attorneys. There are other than good attorneys. There are good electricians. I mean, and other than good. So, I mean, you've got to get yourself to the pair of hands of a good dentist, get a thorough examination, and rule out the mouth as a possible source. If you have a healthy mouth, wonderful. That's great. We're not looking for problems unless you have them, and then we want to find them,
Right.
and then go for the treatment on that. And dental care is not expensive. Dental neglect is very expensive, and that's why if we can, and in more ways than one, financially, but medically it can be very expensive. So that's the whole idea. Identify the problem, and you can bring the information to your physician. In fact, the next time you see your physician, why don't you ask them, does my dental health play any role in my medical health? And just see what their answer is. Because they haven't been taught it. And I'm not blaming them. They just haven't. This is foreign to them. This is new to them. And so it's time for a medical dental revolution. And this would be a really good way to start it. And you're the ones that are going to help us.
Yeah. And as we talk about this being Dr. Chuck's mission, we want to encourage you that he did an amazing job at a local Rotary. If you're looking for a speaker and you want someone who's pretty much going to captivate the audience, you want to talk to Dr. Chuck. He's also speaking to a group of kids because it's dental health children's for kids,
right?
Their thing, So, but if you're interested, Dr. Chuck is available to speak. He loves to do it. And
what was interesting at the Rotary meeting that we were at is that after the talk, there were people raising their hands. So I've been dealing with high elevated white blood count for a long time. They couldn't figure out what it was. Finally, I went to my dentist. Turned out it was my tooth. Again, 90% of dental infections have zero pain. High blood pressure doesn't hurt, diabetes, glaucoma, and cancer. So if we're waiting for the pain, it could be too late. So just because your mouth is comfortable, you still need to get it checked out.
Awesome. Dr. Chuck, you pretty much rock. Thank you. Have
Teamwork.
a great day. It is teamwork. Have a great day. Take care.
Thank you.
Thanks.